Welcome, everyone, to Let the Journey Begin. I am your host, Hilary Roberts, alongside my co-host, our executive director of the Red Songbird Foundation, Alex Nishi.
Hilary, how's it going?
Man, it's good. It's good. I'm really getting excited about speaking at Town Hall this weekend.
Yes, we are excited for you to come out and join us for this one. We know that you a little under the weather for the last one, so you weren't able to join us, but we're excited for the cast and crew that we'll have here on April 10th. So with that being said, are you enjoying the Tennessee special of not having Jason around?
Not particularly. That's only sometimes when he is really a brother and I got it. No, just kidding.
It's okay. I miss him too.
I miss him.
He'll be back for our events and stuff that are coming up in the next few months. We've got the Town Hall on April 10. We've got the golf tournament. We've got a new event in Vegas on April 30th. That's pretty exciting. We got the Angels game on June 26th. So if you're around, whether you, Hilary, or the audience, we got a lot of stuff and a lot of fun going on. So come on out and join the activities.
Yeah, and I did want to do a little spotlight on the newest town hall, which is it's going to be kind of a focus on suicide, which I know we're going to talk about some with our guests today. But I'm so grateful with the very dark places that I went through that I did not choose a permanent solution to a temporary problem. It just felt so permanent at the time that I experienced so much pain for so long. I just never thought I could have the freedom. And I'm just so grateful that today I can talk about that experience without somebody talking about me and living through the experience of me attempting and going through that.
Yeah. And since you bring that up, we had an event. It was about a little over a month ago that locally we had a kid that tried to take his own life by jumping off a bridge here in Ladera Ranch, California. And it was that event that a couple of people reached out to me to, one, bring it to my attention and discuss what we could do about it, especially for the community. And that caused me to reach out to our guest, who I'd like to welcome on in a second. But this gentleman and I, we started talking about what could we do proactively right now. And I reached out to the city of Mission Viejo and Leslie McDonald specifically over there, who's the head of their mental health programs and services. And we put together this town hall as a response, call it a community response, to bring awareness, education, resources, and hopefully some solutions to the local town of Mission Viejo, Ladera Ranch, Laguna Hills, and the other neighboring cities. So that brings me to welcoming our guest, a man that I actually didn't know of until one of our colleagues, Jana Woodbury, put us in touch. And it was funny because he's tied to Preston Durnford, who we did the golf tournament with last year. And, we've done some stuff with Epic Journey, but I blame Preston for keeping this man a secret from us. But I'm glad that we came into his introduction and his presence. So I'd like to formally welcome Gil Carmona. He is the clinical officer at SoCal Mental Health. He's got 30 years in behavioral health and mental health, social or master's in social work. I mean, everybody I've talked to now that I know you, about you, knows you. And I'm going, how come I didn't know you? So welcome, Gil. We're happy to have you here. You're one of our guest speakers on the April 10th Town Hall beside Hilary, our other host here on camera. And it's going to be a great town hall. I'm excited to hear what you got for us today. We're going to learn a little bit about you, a little bit about what you do, where you do it, and how you got into behavioral health.
Yeah. Hi, Gil.
Hi, Hilary. Nice to meet you. Alex, thanks for the nice welcome.
Yeah, absolutely. So Hilary, I'll let you start poking and prodding into his wealth of information and knowledge, and then we'll see where it goes.
Yeah, Gil, this is going to be really deep. So what did you want to be when you grew up?
What did I want to be when I grew up? I have always been someone that's been very in tune with oppression and adversity. And I think having gone through my own struggles, I felt like I was always wanting to be someone who could facilitate and give a voice to those that don't or believe they don't have a voice, and instill hope in those that feel hopeless. So I was always kind of the person people would go to talk to and be able to give some guidance and direction. So that's been my life throughout, my being in elementary school through college and now in the community.
So you've been one that has wanted to just help people, help make a difference. That's so precious.
How did you identify that? Or was it something where the environment kind of pushed you into that role?
Well, I think when you study psychology and you look at kind of social work, and social work is, treating the person in the environment. So, I elected to go that route and become a licensed clinical social worker because, again, it's helping the disadvantaged, helping the disenfranchised, helping, those with, disabilities, and mental health falls in that category. Addiction falls in that category. So again, always wanting to be of service and of help. But I particularly had a very significant catastrophic stressor in my upbringing that really propelled me then to really want to be there for others and to teach resiliency, as I was trying to find my own to recover from that traumatic event.
So can I, and of course you don't have to answer, can you tell us what the traumatic event was?
Absolutely, Hilary. I think for me, at age 14, my father committed suicide. So unfortunately, it was just, so traumatic that it changed our lives from that point forward. And I found over time that the worst thing that happened in my life ended up being the best thing, because it really pushed me to not be a victim, but to be a survivor, to really study, why does suicide happen? Is it a character flaw? Is it some type of disorder? And discovered that clearly, someone can fall into a chronic deep depression and not be able to map out and look for resources. As you were kind of sharing earlier, Hilary, you can get to a point where you feel like there is no option.
Yeah.
So sadly, to experience that and see what it does, not only to the individual that terminates their life in terms of not ever resolving, but finding peace, but for the family, again, it was devastating to have to manage and cope and pull together. And I was raised, where you didn't seek professional counseling. You just went to church and you prayed about it. And it wasn't enough. It really required, seeking psychological help. So I struggled until I decided that I just had to pull myself out of this and pursue an education so I could really understand the dynamics of how this happens and to really help people in their time of need. So it's so interesting that's why I say the best thing out of this is that I became a helping professional, really educating the public, educating people who come into an office when you see them, to really instill hope and know that there's a solution when you have to, again, seek help so that you don't allow your thoughts to become an intention and then it becomes a plan. Yeah. Once that happens, it's over. The person struggling now needs to complete it because they finally are relieved to not suffer anymore. So we want to educate the public. And I think this community presentation really is an opportunity to let people know, seek help. Now we want to destigmatize mental illness. When people do suffer with depression or anxiety, this is a coping mechanism, but an unhealthy one. So we have to provide prevention and most definitely intervention.
So on that note, real quick, if I may, so the awful event happened when you were 14, and when did you decide to start seeking help, or did you seek education first? And out of both of those, which one happened, and how old were you?
Yeah, I think as I reflect, I think that I recognize that I fell into a depression and I stopped, socializing. All I focused on, I was good in school and I always excelled in school. And I figured, as the eldest son of three children, biological children of our family of origin, I knew that my way out was to take care of my family. I had to get a job, and I figured to get an education, to get a degree, then I could really help my family and help myself. So sadly, I think the school counselors, they kind of missed that I was not doing well. The only thing I was doing well was in grades, but I was not, I just would hide out. I was not coping very well. My family didn't know what to do. And I just figured, again, that I had to find a way. And my ticket was to excel so that I could move to California, go to the university and ultimately become a therapist. I originally thought I wanted to be a psychologist until I met someone who said, have you ever considered social work? Social work does a number of things. So pursuing the license, then I started into private practice and started working in the social service arena, where you do see people who don't have the means, who don't have access to resources. So then you just need to, again, assist so that through public resources, mental health counseling is available. There are support groups. There's a lot of hotlines. So it's just educating people that the resources are there if you know how to seek them.
So, Gil, you said a couple things that stuck out to me. So one was that this event. So I would like to ask a question for clarity. Was it this specific event that really inspired and spurred you into chasing that education and really trying to discover what is going on or what was happening or why are you feeling this way and all of that?
It truly, I think, when I look at what was the influential force, this was it for me. I knew that how could it happen to our family? What did we possibly do wrong? And I figured the best way is to understand the underpinnings of this, phenomena. Why does it happen? And I think when you are a survivor of a family member who commits suicide, you're traumatized by it. So again, if you're not seeking pastoral counseling or professional counseling or going to a support group, extended family doesn't know how to manage this. So it just created such chaos that I figured I really wanted to understand and see if I could in some way cure it, or if not, prevent it from happening to others.
I think it's absolutely brilliant and remarkable that rather than, shut down or the why me or poor me's, you decided to grab life by the horns and, try and figure out your own solution. So I just wanted to give a compliment on that. But the question I had was on another thing that you had mentioned, as far as going through school and these counselors basically just kind of waving over you because the grades were fine, but not really seeing what was going on under the hood. And the reason why this is a poignant thing to me is because, and Hilary's aware of this, but currently we're trying to work on some programming with a local private high school here to incorporate a much more encompassing mental health coverage of the student body, so that the counselors are not in a wheelhouse that's not theirs, and two, these kids are not just slipping through the cracks. So my question to you, based on your 30 years of experience and essentially you going through it yourself, how many kids these days do you think go through the same exact situation that are not being seen or heard?
Oh, I think it remains prevalent. I think we don't really acknowledge and recognize that mental health is so critical, and especially in adolescence when it's already a state of confusion and identity formation and fitting in. And if you're experiencing bullying, rejection, being ostracized, kids already struggle. So that became kind of my calling, was adolescence in crisis. When I was able to graduate, I knew that I wanted to get into private practice. And again, going back to helping the adolescents. So I would deal with the adolescent in crisis, or the acting out adolescent and the family in crisis. So I became skilled at family therapy to really help the parents, but also to advocate and ensure that the school was aware. So there's, when someone is showing a disability and it can be emotional, families can ask for an independent education plan so that services can be provided, but also training teachers and school personnel to be alert to the signs and symptoms that are apparent when you see someone beginning to struggle, isolate, not come to school, see that they appear, in a kind of with a depressed mood, to reach out. And a counselor or a teacher never approached me and said, "Are you okay?" Because I think I would have said, "I'm not." And I think my mom as well didn't know what to do. So I just found that it was just more internalizing. And so again, I'm really good at, I think, in normalizing for people that does not mean that you're mentally ill, that you're crazy. You will suffer from these stressors, and how you cope, how you manage will be significant in terms of the support systems around you.
When did you get help for yourself? So you're out here, you're getting educated, you're doing all these things to help others, but when did you dig into your stuff?
I did, after I graduated from UCLA with a degree in psychology, and then I went to USC to pursue my graduate degree, and you begin to study the theory. They'll say, and they advise, that before you can help others, got to be able to help yourself. And I figured that there was still issues because of the residual effects of just managing and coping without our father, not ever dealing with it, that there was just issues that I felt before I start working in the field, I really should engage in some personal psychotherapy for myself. And I think it came around the issue of when I got married, and then I decided to have children, that it was really important for me to go back and resolve this stuff that was still hanging over me, that you just can't sweep away or sweep it under the rug. Once I was able to go to therapy to really start understanding my issues, it was remarkable how much was needed to really kind of, you learn to suppress and somehow kind of manage. And fortunately, I didn't resort to drinking or risky behavior. I just know that I needed to find myself, and there was a lot that was still unresolved.
That's very smart. I don't think a lot of people consider, granted, I'm not going to talk generally because I don't know every therapist, but I feel like, and this is only in communications with those that are personal friends of mine, but I know for a fact that I have probably at least 5 of them that got into the practice to try and figure out their own problems. Where what I'm hearing from you is, it's like what Jason says. When you take your car to the mechanic, don't tell the mechanic how to fix your car. You take it in, take direction, right? And it sounds like that's kind of what you did from the foundational basis of, well, you can't pour from an empty cup, right? And everybody says it all the time. It sounds super cliche. We hear the airplane oxygen mask metaphor or analogy, but you actually did it. And based on doing the work and working on yourself and then going into practice, do you feel like it made a substantial improvement in how you were able to help people? Or do you feel like it was more just a personal goal that you needed to accomplish for yourself for that kind of fulfillment, and then you'd be able to relate the experience to help others?
Having, worked as an administrator, at USC, and eventually kind of help those that come in to become trained professional social workers, you want to plant the seed that, you cannot, help others if you don't understand the true nature of struggles that people have. So again, often, if you're working with the substance abuse population, they will often ask, have you walked in my shoes? In that arena, I have not, but I've worked extensively to understand the theoretical components of it and the psychosocial stressors that will impact someone to use substances. And again, not know that there's a pre-genetic disposition that you might find yourself addicted. And now in this day and age, we're finding that mental illness is also a disease. So therefore, again, the assumption is that if you are wanting to harm yourself, or you're depressed, or you're anxious, or you hear voices, we're saying that treatment is beneficial. Mental health is as important as your physical. So we want to look at mind, body, and spirit so that people are open to seeking help. And help can be, again, be it that you worship and you find solace in your religious community, that you can go to a support group, that you can be open to medication. Now I think people are much more open to go to outpatient counseling and get help, or parent education. So it's, again, just attempting to encourage people to follow through. So even with my students, as they were getting ready for graduation, as they were working with others, is not to forget that, to sit on the other side and know what it's like to be a client and how vulnerable it requires someone to open up and trust someone is not easy to do. But when you can say, I've been there, I have walked in your shoes, I have suffered a loss. We just had a community meeting, Preston and myself, on Saturday with our house of those with primary mental health. When someone shares their story, it normalizes for people, for others, that, I am like you, you are like me. I'm not the person needing treatment. We all struggle with life. And sometimes when we have setbacks, when there are obstacles, it's finding the coping skills. So what I discovered through my adversity is that I had resilience, that I was able to, pick myself up and pursue and seek and read and try to comprehend, so I wouldn't be defined by that and then find that I couldn't move on and be able to do for myself. So again, became very successful in training, educating, providing public presentations, and letting people know that the first thing you can do is, one, acknowledge the problem, but more importantly is to seek help.
Everything you said, very eloquently put, and I firmly believe everything that you're preaching because I feel like I've been through some of it, granted in a different lens, right? So with everything that you've gone through in your 30 years and the stuff that you've experienced personally, for our audience listening to us today, and granted, this subject is a little bit harder hitting than some of the other things we've talked about, right? That's why we wanted to do this town hall on mental health and suicide, because it is a very stigmatized subject. But with all of that, can you recommend an action for the day? Something that can benefit anybody, anytime, very easily, one of those low-hanging fruit kind of suggestions. Do you have anything for us?
Self-care, I think, is critical. That is often just said but not done. And self-care means, eating healthy, being able to sleep well, exercise, be able to socialize. With COVID and the pandemic, it threw quite a wrench in people's existence. It was a new normal that also heightened depression, anxiety, substance, use and abuse. So I think what's important is for each one of us to be mindful of, again, how important taking care of your health, physical health, and making sure that you're getting your annual physical exams, being able to deal with the daily stressors of life. And, when we talk about it as stressors, that's just, again, a family member, passing away, divorce, a major move. You know, there are a number of things that people have to learn how to manage and cope, and not simply allow the event to affect them and not do something about it. So again, just letting your primary care physician know that you're not in a good place, that you're struggling, that you're not sleeping well, that you have a loss of appetite, or there's an increased sense of a depressed mood that you can't seem to shake loose. The more that you reach out, I think now with telehealth, now with support groups that are out there, now with just YouTube, there's so much information. If people just simply become informed to take action, that's why I believe in prevention. There's a lot you can do in advance by just being aware, being knowledgeable. And then if you now have some awareness, then intervention takes all different levels. That's why I say talking to someone, going to a support group, seeking, through your employee assistance program, all that help is out there. You just have to be open to recognizing that it is a sign of strength, not weakness, to seek help.
No, that's great. So what I'm hearing is take inventory, see, do your self-care, take inventory. If there's anything that you're not happy with or a feeling that you're not good with, reach out to somebody, seek outside advice or help, preferably from a professional. I mean, friends and family, they're great too, but if you can get a professional help, that's where to get it from. And if you don't know where to get it, then perhaps reach out and utilize some resources that you may have literally right under your nose. Hilary, do you have any last remarks or last comments for our guest?
No, I love the self-care aspect, and even as much help as I've gotten, there are some days where it's like, and the pandemic gave me a run for my money, for sure. I mean, I am deeply involved in my support system. I go to therapy all the time. Well, I was at once a week for a long time, and now I'm at twice a month. But I do things to still take care of myself. And there were just some days I'm like, I could go walk outside, but nope, I think I'll stay here and watch more of these shows and oink, oink on some food.
Right. I think that was a lot of people, myself included.
Yeah, and I was just kind of feeling like, okay, and I think the worst words for somebody when they're isolating or depressed is, what's the point? Well, we don't need to have a point. The point is that you get up and you do the next thing. And you don't think about the rest of it. You just, as they say, pray with your feet. But I can understand the struggle, I've been there.
Correct. Mm-hmm. And I wanted to add, Alex, the reason I felt that a psychiatrist being on the panel is to also normalize for the population, what does a psychiatrist look like? And he's board certified in psychiatry and addiction medicine. So I'm very, I work closely with Dr. Lawrence Tucker. So it's helpful when, a subject matter expert who knows the brain, who knows medication, can just simply convey to people that, he's a person just like everybody else. He specializes in mental health, substance abuse, and he's his own healer in many ways using traditional medicine. But he's also talking about mind, body, and spirit. Medicine is one piece, but therapy is another, self-care is another, support, systems. But I think it's helpful for the doctor to be able to be present and answer questions so that people aren't alarmed by and think that this shrink is going to be judging you. This shrink is really trying to help you. And he's very gifted in helping people in need. And he'll often say, people don't need to suffer when we can adjust using medication. So you always want to go to a specialist for that. So I'm pleased that he's willing to come to be able to, again, for the public to put a name to a face and see that doctors are helpers as well. And they've got their specialty, but they're going to collaborate with all other disciplines. So it's the therapy, it's a nutritionist, It's going to meetings. It's doing all those things for your wellness.
But not to try to use the same brain, the same perceptions that have kept, and I'll say this as a patient, as a client, okay, that I cannot have the same brain, the same mindset, the same perceptions to try to get me well, because I'll be so busy projecting what I think you're thinking about me, and I'll look through a view that is not well. Can I just set it all aside? Can I just believe that this person has the very best intentions for me and that they want the best for me, and not believe it's something awful that's going to happen again?
No, beautifully put. No, Gil, every time I get in front of you and hear you talk, I'm just more and more impressed. I mean, this show was your spotlight, and here you are trying to share it with Dr. Tucker. Now, for those of you that are listening that are in the Orange County area, we will have Dr. Tucker and Gil joining us at the town hall on April 10th in the city of Mission Viejo at the Norman P. Murray Center. The show is going to start at 4:30 p.m. Go to www.redsongbird.foundation.com/townhall to register if you haven't. Gil, for our audience that would like to find out more about you and SoCal Mental Health and look up Dr. Tucker here, I looked him up personally. I can vouch for his credentials and everything that came after his name, so he's good in my eyes. But where can we find you?
I have a website as well. It's gilcarmona.com. And I often I do quite a bit of presentations. I'm also, a consultant in the behavioral health care industry. So you can Google me and find me. I also have a private practice in Rancho Santa Margarita. And I treat, adolescents, adults, and couples. So it's, again, still I do administration, but I also still do direct service. I feel my calling is still to always want to help people. So I'm always there to be a resource to guide people and help them navigate the system, and continue to be a voice and an advocate for the disenfranchised and the clients that suffer with a mental illness. There are so many resources now that are available to overcome and manage your symptoms. If they Google me, they'll definitely find me, and I'm more than happy just to always, help anyone in need, to guide them to a resource to find out what insurance they have, that where they can seek either privately or publicly resources within their insurance plan. But there's so many, there's so much community support out there that we just want to educate people, and I really want to plug the National Alliance for the Mentally Ill. This is, a very strong platform that's there for education and helps people get on there to learn about themselves and their condition, learn about medication. But they have a peer support specialist program. They also have a family-to-family. Once you go and join a support group, then it just helps ease the discomfort that others struggle as well. So I'm just, a resource, and I'm kind of a gatekeeper. So I'd like to just guide either organizations or families or professionals on how best to reach, our community, to educate them and to empower them.
Beautiful.
So fabulous, Gil. Thank you so much. And I'm looking forward to meeting you face to face.
Likewise.
Our town hall.
Yeah, Gil, thank you again for coming on and joining us and imparting your wisdom on us. And we're looking forward to seeing you on the 10th to get a little bit more out of you.
Indeed.